Before watching this video, subscribe our channel, press on bell icon to get more updates. Today we will discuss the drug review of propofol. My name is Dr. Talha Miraj and these are my contact details. Generic name propofol, chemical name 2,6-diisopropylphenol. This is the chemical structure of propofol. Molecular formula C12H18O. Molecular weight 178.27 gram per mole. Drug category general anesthetic. Propofol is an intravenous anesthetic agent which is used for the induction and maintenance of general anesthesia. IV administration of propofol used to induce unconsciousness, after which the anesthesia may be maintained using a combination of medications. Recovery from the propofol-induced anesthesia is generally rapid and associated with less frequent side effects. For example, drowsiness, nausea, vomiting, then with thiopental, methohexital, and etomidate. Propofol may be used prior to the diagnostic procedures requiring anesthesia in the management of refractory status, epilepticus, and induction or maintenance of the anesthesia prior to the surgery. These are the contents which include dosage form and strength of propofol. Propofol is in two types of strengths. One is 1% and second is 2%. In 1%, the propofol is 10 mg per ml, and in 2%, propofol is 20 mg per ml. Propofol is made up of the emulsion of propofol is a white aqueous isotonic emulsion including glycerol as vehicle, purified egg phosphatases, sodium hydroxide, and soybean oil plus water. Pharmacology, as you know, propofol is used as a sedative hypnotic agent in the induction and maintenance of general anesthesia as well as sedation. The intravenous injection of propofol is given is given to the patient, and usually within 40 seconds of from the start of an injection. Mechanism of action: propofol bind at the allosteric site of GABA A receptors and block the propofol bind at allosteric site of the GABA A receptor and block the transmission of signals through the neurons. It is short acting lipophilic sedative, hypnotic, cause global CNS depression, and presumably through agonistic action of GABA A receptor. Absorption: the onset of unconsciousness is 15 to 30 seconds due to rapid distribution of propofol in the plasma to the CNS, and the distribution is so rapid that the peak plasma concentration cannot be readily measured. Duration of action is 5 to 10 minutes. Distribution: it is rapidly and extensively distributed in the body, and it crosses blood-brain barrier very quickly in short duration of time. The protein bonding of propofol is 97 to 99%. Metabolism: propofol is basically metabolized through glucuronidation and hydroxylation and conjugation, resulting into hydroxypropofol, which has approximately one third hypnotic activity of propofol. Excretion through kidneys in the form basic excretion is through kidney in the form of urine, and some of the excretion is through feces. Half-life is 40 minutes initially and then 24 to 72 hours. after the 10th day of infusion. Route of elimination, it is eliminated by hepatic conjugation, volume of distribution 60 liter per kg, clearance 23 to 50 ml per kg per minute, and 1.5 to 3.4 liters, 1.6 to 3.4 liters per minute in 70 kg of person. Biological half-life, initial distribution phase half-life is 1.8 to 9.5 minutes. In secondary distribution phase, 21 minutes to 70 minutes. In terminal elimination phase, the half-life is 1.5 to 31 hours. Indication, it is used as short-acting anesthetic in the form of IV, so short-acting IV anesthetic for the induction and maintenance of general anesthesia, for sedation of ventilated patients receiving intensive care. Primary and secondary and tertiary hospitals. It is used in primary, secondary, and tertiary hospitals. It is Schedule G drug. Dosage 55%, 55 more than 55 years person should receive this dose. 40 mg IV per after every second until the onset of unconsciousness, when not pre-medicated with any oral benzodiazepine or any intramuscular opioids. If person is less than 40, if person is less than 55 years or deliberated or belongs to third or fourth class, 20 mg IV per after every second until the onset of action, and 1 to 1.5 kg, 1 to 1.5 mg per kg. Do not use rapid bolus because it will increase likelihood of undesirable cardiorespiratory depression, including hypotension, apnea, airways obstruction, and oxygen desaturation. Maintenance, more than 55 years, person 0.1 to 0.5 mg per kg per minute IV administered in a variable rate of infusion with nitrous oxide 60 to 70% of the oxygen provides anesthesia for the patient undergoing the general surgery. Maintenance infusion should be immediately follow induction of dose to provide the satisfactory and continuous anesthesia during the induction phase. Intermediate bolus increments of 25 to 50 mg or 2 to 2.5 to 5 ml may be administered with nitrous oxide. In adults undergoing general surgery, administer incremental bolus with change in vital signs indicate response to the surgical stimulation or light anesthesia. Dosage, less than 5%, less than 55 years patient belonging from 3 and 4th class, 0.05 to 0.1 mg per kg per minute IV. For max sedation mean monitor anesthesia care. Sedation is a type of anesthesia service during which a patient is typically still aware but very relaxed. Initiation 0.1 to 0.15 mg per kg per minute IV for 3 to 5 minutes. Titrate to the desired clinical effect. Monitor respiratory function. Administered as slow infusion or slow injection while monitoring the cardiorespiratory function. Slow injection 0.5 mg per kg administered over 3 to 5 minutes. Titrate to clinical response. In elderly patients, do not use rapid bolus dosage. Rapid bolus dose administration over the 3 to 5 minutes. Reduce the dose to approximately 80% of the usual adult dose according to the condition, response, and change in vital signs. Maintenance, variable rate of infusion method preferable over the intermediate bolus dose method. Variable rate infusion method 0.025 to 0.075 mg per kg per minute IV during first 10 to 15 minutes of sedation maintenance, subsequently decrease infusion rate over time to 25 to 50 microgram per kg per minute, and adjust clinical response. Allow approximately 2 minutes for onset of peak effect to titrate clinical response. Titrate downwards in the absence of clinical signs or of light sedation until the mild response to the stimulation obtained, to avoid sedative administration at rate higher than clinically necessary. Intermediate bolus method: administer 10 to 20 mg increments and titrate to desired level of sedation. Elderly 0.02 to 0.06 mg per kg per minute IV. Do not use rapid bolus dose administration. Reduce the rate of administration to 80% of the usual adult dose according to their condition, response, and changes in vital signs. Post-operative nausea, vomiting, 20 mg IV may repeat. In ICU patient, initiation 0.005 mg per kg per minute IV for at least 5 minutes. Titrate to the desired clinical effect. Increase by 5 to 10 microgram per kg per minute over 5 to 10 minute interval until desired sedation level achieved. Allow a minimum of 5 minutes between adjustment for the onset of peak effect. For medical ICU patient or patient who recover from the effect of general anesthesia or deep sedation, rate of administration of 50 microgram per kg per minute or more be required to achieve adequate sedation. Maintenance 0.005 to 0.05 mg per kg per minute IV. Individualize and titrate to the clinical response. 0.005 mg per kg per minute increase after every 5 seconds. Discontinuation: avoid discontinuation prior to weaning or for daily evaluation of sedation level may be result in rapid awakening of associated anxiety, agitation, and resistance to the mechanical ventilation. These are the terms of physical status classification of by the American Society of Anesthesiologists. Class A, healthy person. Class first class, healthy person. Second class, mild systematic diseases. Third is severe systematic disease. Fourth is the severe systematic disease with constant threat to life. And fourth are those persons who will not be survived if operation was not done. And fourth is those person whose brain is dead, but their organ can be donated to the other persons. Administration: propofol shake well and it can be diluted in 5% dextrose to 2 mg per ml, and to reduce pain associated with injection, use large vein of the forearm, which is cubital fossa, and lidocaine 1 ml of 1% solution may also be used prior to the administration. Do not use filter with 5 micron for administration. Soybean emulsion is used, as these are the information which are given in previous slides. Compatibility: 5% dextrose, ringal lactate 0.5% dextrose in half normal saline, 5% dextrose in 1/4 normal saline, 5% dextrose and ringal lactates are the solutions which are compatible to propofol. These are the drugs with which the There is propofol drug-to-drug incompatibility, which include amikamycin, amphotericin B, calcium chloride, and levofloxacin, methotrexate, and other drugs, morphine sulfate. Chemical compatibility, already told. Solutions which have compatibility, already told. And advice side, dopamine, butamine, ketamine, lidocaine. These are the drugs which are compatible advice side to the propofol. Stability, intact container should be stored at 2 to 8 degree. Protect from freezing. Contraindication, hypersensitivity, like egg allergy, soybean allergy, child, severe cardiovascular and respiratory disease, epilepsy, seizure, hyperlipidemia, hypotension, cesarean section deliveries. Drug vehicle emulsion. These are the also things which are told prior. There is chance of microorganism growth, and secondly, don't use IV catheter having use for the transfer of blood or blood products. Propofol lack analgesic properties, so proper management of pain management is required to use analgesic agents with, and do not give bolus to class 3 or class 4 patients. Rapid bolus dose will increase cardiorespiratory effect, hypotension, apnea, and airways obstruction. Toxicity, LD50 is 53 mg per kg in mice and 42 mg per kg in rats, and oral LD50 of soybean is 1230 mg per kg and 800 mg per kg. Overdosage is likely to cause cardiorespiratory depression and respiratory depression, and where the antidote is concerned, if respiratory depression is occurred, then it should be treated with ventilation, with artificial ventilation with oxygen. Pregnancy category B, lactation, excreted in breast milk, effect on nurturing, effect is unknown on infants. 372 drugs have interaction with propofol, 8 major interaction, 278 moderate interaction, 7 minor interactions. Adverse effects, hypotension, injection site burning, respiratory, acidosis. These are the brand names available in Pakistan: Diprivan, Free-Sofol, and propofol, Lipro. These are the references from where I collect these information. Thanks for watching, and I hope you like our video. If you like our content, press like button and turn on notification to get more updates.